Hello, everybody. This is Tony Heil with ALS United Mid-Atlantic, and this is our new Goals podcast. I hope you've been listening to some of the past episodes, which have included discussions with Elisa Brownlee about accessibility, Crystal Goodwin, one of our board members, and patient perspectives like with Sarah Brendel about what it's like to live with ALS and the services we have here at ALS United Mid-Atlantic. One of the most important things we provide to patients and their families is connections through social workers. Social workers are so important to improving the lives of people with ALS, giving them direction, and empowering them to make the best decisions possible throughout this challenging journey. And I am really proud to work with two people who will be on here today. You can see them on the screen if you're watching on YouTube. They're my guests, social workers Melissa Coll and Ann Cooney. They have a lot of experience working here and in social work generally. So we're going to talk about their experience, what it's like to advocate for people with ALS beyond just politically advocate, but like advocating for them through things like insurance or answering their questions or making sure that they know someone is in their corner. So I hope you'll listen to this and learn a lot about social workers and our programs. And again, as always, if you're interested in our events or need help with ALS or have some questions, learn more at alsmidatlantic.org. So Melissa and Ann, thank you for talking today.
Hi.
Thank you. Thank you for having us.
So it's hard to know if I should go alphabetically by first name with Ann or alphabetically by second name with Melissa. But let's go. I forget which one of you started here first.
I did.
Yes. And then you guys have known each other for a long time, though, right?
Yes, we met in grad school a long
And
time.
we'll just say a long time ago. So, and I really appreciate that you guys have been working in social work together, whether it's ALS or otherwise, for so many years. So you've learned a lot from each other, even beyond what you do here, right?
Yeah,
I couldn't, she is like my sounding board for so many things, so it's very helpful.
And I think that you're both the sounding board for a lot of us here. I had a non-ALS health issue with a family member recently, and I knew I could reach out to a few people here and say, hey, what should I ask for? And just being able to work here or be a volunteer here or a board member provides us with a resource where I know I can ask you or Gail or someone, hey, what do I do? What kind of wheelchair do I need? Because I don't know. And you guys are always here to help, right?
Absolutely. We have lots of experience.
Mm-hmm.
So for Ann first and then Melissa, just looking at my eyesight here, what does it mean to you to be a social worker? Because this is Social Work Month as we record this.
I don't know. I've always wanted to work with people, and my mom told me, and I have no recollection of this, but when I was a little girl, I would say, I just want to help people. And so that's how I think from a very young age, I wanted to be able to help others who were in need. And as I went through school and everything and discovered social work, I knew I had found the right spot. And I love working with people. I especially love working in a medical setting with a medical team, an interdisciplinary team, and that whole approach that we take, especially with our ALS patients, where every discipline is so important in the full, package of caring for our ALS patients. And it just gives me a lot of pride to be a social worker. And, at times it's very rewarding, and you feel good to help others. It's a job that gives back a lot, even though this is such a tough disease. And, the ending is very hard. I feel like I've learned so much from my patients and families, and to me, that's just worth its weight in gold. So I love this job. I love working with everybody, and I just really get a lot of satisfaction from doing what I do.
I really appreciate that. I feel the same way from my role here. When it comes to being a social worker with a multidisciplinary setting, like you said, is that usual in healthcare, or is it special with ALS that we have that kind of care for our patients?
It's more typical than not, in especially in a hospital setting. Depending on what unit you're working on, there's usually a team that provides care to that type of whatever like neurology or orthopedics or cancer. There tends to be a team approach, but not all over the healthcare system. There's a lot of individual things that go on as well. But I've just always really enjoyed working within that team because I feel like I learned so much, and it doesn't it doesn't get dull, it doesn't get boring. There's always something to learn, which I enjoy.
So, Melissa, what does it mean to you to be a social worker then, too?
Well, similar to Anne, I really love my job here at ALS United Mid-Atlantic. It's such a great team that we work with just within our own group, and then the interdisciplinary teams that we work with the clinics throughout our service area. I love meeting new families and patients and hearing their stories, and it really, like Ann said, it's a privilege to be there for these families and kind of walk through this journey with them and be able to guide them, and we're always learning and getting just as much out of it, going through the process with them. But just to be able to let people know that there's someone there that will listen and try to help navigate and answer questions. I feel like that's a lot of feedback that we receive often from families. They may say like, "Oh, I never really knew what a social worker was or what they did, but I so appreciate you being here for me," or when I call, I know you're always going to help me figure out a solution, and that is just so rewarding to know that we can give comfort to families in such a trying and difficult time in their life.
Yeah, when Rocky was fighting in the movies, he had someone in his corner. So you guys are like, the person in the person with ALS's corner, like Rocky had, right?
Yeah.
So,
We try to be.
Melissa, since you work in a team, when does a person with ALS first meet you?
So typically soon after diagnosis for patients at the Jefferson Clinic, they meet us at their first clinic visit. Sometimes we meet them before. It just depends on the timeline of their journey. And other patients that attend different clinics, or some that opt not to attend a clinic, as soon as they're registered with us. So we always appreciate raising awareness. People can actually go on our website, alsmidatlantic.org, and self-register with us. As soon as someone with ALS registers with our organization, they're automatically assigned a social worker. So we may talk to them on the phone. If they're have communication issues and they're not able to talk, we can email or text, or sometimes we set up a home visit. We just really try to meet the patient and family where they are in the process. Sometimes in the beginning they're not ready for us, and that's okay too. And so we just try to make sure people know that we're here and we're available to them.
And you have experience in social work even beyond ALS, but from my understanding, watching you guys work, there's not a typical ALS case, right? Like one person's story might be very different, not just might, but will be very different from the next person. How do you prepare for that? Is that the way it is?
Yeah, I mean, I think every person's journey to this diagnosis is different. Everybody has a different onset of symptoms. I really see that a lot. I do one of our support groups for ALS patients and their family members. So when we all gather as a group, they all tell their stories and how they came to reach their diagnosis. And truly, everybody is so different. They progress differently. Some are very quick, some are very slow. So in the beginning, especially when I first started, I wasn't really prepared for that because I didn't really understand the disease. This was 13 years ago, as well as I do now. And it can be hard for somebody who's a very slow progressor sitting with somebody who's a very fast progressor, and that person progressing fast is struggling because their symptoms are just increasing and changing so much. So it's challenging. It's certainly challenging for the person with ALS and their family members. And it's challenging as social workers to support them through everything and try to, just guide them as we go along. When they don't have time to catch their breath because something new is happening, that can be very, very hard. So we're just there to kind of do what we can to support them, provide resources to help with the changes and the needs that they have, and just, keep tackling it day to day.
One of our founding board members, Ben Orenstein, just passed away. He had been supporting us for over 40 years, and one of the ways that he made such an impact with his wife Dottie was through those support groups back in the early 1980s. What kind of impact do those groups have, and what value is it for patients and their caregivers?
I think number one is they don't feel alone. This disease is still very much a rare disease. And, when they come to group for the first time, I would say 99% of the time, they say, I am so glad I came to this. I'm so glad that I've met all of you. It feels so comforting to know that there is someone here who understands what I'm going through. Someone, like, a lot of them reach out to each other between groups and become friendships form. And I just think they feel they're not alone. It empowers them to learn more about the disease. They educate each other on how they are coping with the disease and what strategies are working for them. And then a lot of humor and laughter and jokes, and there's tears and sadness as well. But I mean, I feel like it's an absolute privilege for me to be a part of that, to see how they all come together and how they support one another. It truly is amazing. So I'm very lucky to be a part of that.
Yeah, I've talked with a number of people with ALS, like our friend Craig, who is friends with comedians, and he wants to do things that are fun. He doesn't want to just dwell on the
Right.
tough realities of ALS. It's important.
Yeah.
And Melissa, we talked about how you are like in Rocky's corner when it comes to ALS, right? You're the person there, like cheering them on and giving them the tools. As that kind of advocate, not necessarily in politics, but just advocating for them, what does that mean in your role as a social worker? How are you an advocate for patients?
So, right from the minute that we meet people, both living with ALS and their family members, we try to educate them about really the ALS community, one, about the clinics, what that is going to look like so that they understand, because it's not a typical doctor's visit where you have an appointment at 8:15 and it's 15 minutes and you're in and out, and if you arrive at 8:22 you have to reschedule, you're done. A clinic visit, you're meeting with a whole interdisciplinary team, you're typically there 3 to 4 hours, bring snacks, all that, just logistical stuff. But we try to educate them from the point of going to clinic and then navigating. Everyone's different. We may meet people that when they're diagnosed, they're still working full time. And then at what point do we stop working, looking at Social Security, disability, Medicare, things like that. So really educating them and empowering them from early on, in planning and preparing and helping them to anticipate the next steps. I think that's really a crucial part, so that they aren't kind of caught off guard with some things as they begin to progress, or things that they may be facing. And also really encouraging them, to try out our support groups or attend some of our events within the ALS community. Like Anne said, really, probably the biggest thing is the reassurance to know that you're not alone, or maybe you're struggling with going from a walker to a wheelchair, and then you go to an event and meet all these other people, and to find comfort in knowing that you're not alone. And also, especially for family members, for caregivers, we have a group specifically for caregivers, so they have their own space to talk and connect and vent. It's so important.
Yeah, I was thinking as you're talking, you kind of answered my next question, but what are some of the kind of questions that you think are important to ask at a first clinic visit or even a follow-up clinic visit? Are there things that you think people should be prepared to and be at least willing to ask someone like you?
Um, well, to be honest with you, typically at a first clinic visit, a lot of times when we go in and we're introducing ourselves and explaining about the chapter, they often don't know what to ask. And that's
Hmm.
where I feel like that's really our role, to meet them where they are. Because we may, like I said, meet someone that's functioning independently, working full time. We all also may meet someone that needs care and they don't have it, and helping them navigate that. So it's really about meeting them where they are and helping them figure out answers to the struggles that they have, or anticipating what may come next. I'm starting to have issues with walking and I'm in a 3-story house. What's the plan for that? So with us really getting to know them, it's a lot of times it's more us asking the questions and then filling in, you know, making plans. Or if they're alone during the day, do you have a plan if you were to fall? What would you do? Well, I have a cell phone, but I usually leave it in the other room. Sometimes it's simple things that you don't really think about. So that's really our job, is to help them navigate and anticipate.
Yeah, I imagine for most people, I don't have a plan if I fall. I
Yeah.
don't think about that. I'm at with everything with ALS, Melissa or Ann, like until you experience it, you have no idea what is coming until they talk to someone like you or one of our nurses, right?
Yeah, definitely. I feel like, um, especially those who are still quite independent and are still working, they've got some impairments beginning to happen, but they're still kind of living their lives. So that nobody is really thinking, well, what am I going to do if I fall down? Because in their head, they're still moving, they're still doing things, they can still do things. The brain and the mind is a powerful thing over the body when your head is saying, oh, sure, you can get up and walk across the room, but the body doesn't cooperate. And that, I feel like that tends to begin to happen with many people, and there could be a fall, there could be a mishap at home, and then the reality of the situation comes into play, and then you can really begin having those discussions about what can we do to keep you safe. Because I always say it's most important to be safe, because if you're safe and you can still do the things that you want to do, you might have to do them differently, but you're doing them safer. And I always tell everybody, if you have, at a clinic visit, I said, if you have medical questions, you want to call your clinic team, specifically at Jefferson, our nurse practitioner. But any other question you may have, you call me. And if I'm the one to help you, I'll help you. If I'm not the right person, I will get you to the right person. So they know they kind of have 2-point people. They have their nurse practitioner and doctor, and then they have me. And we kind of, attack it that way.
And it's not just the person with ALS that you talk with. I know that so many of those issues are extra stressful to the caregiver.
Yes.
How do you help a caregiver for someone with ALS?
Well, I think we let them know that, we are here for them as well. That being, just because you don't have ALS does not mean you're not being affected by it. You are being affected, and you're being affected differently. And you have to take care of yourself in order to take care of your loved one. So we really, when they come to clinic visits and or when we do home visits, we're really, we're going to see that person who has ALS, but we're really doing a check-in with the caregiver as well to see how they're coping and managing. Do they have enough support, or are they overwhelmed? And if they are overwhelmed, what can we do to try to ease the burden of, what they may be going through and what they're feeling? And that can be tricky at times, because many caregivers don't want to say that they're overwhelmed, that it's too much. They don't want to ask for help because they want to be there. They want to care for their loved one. And I mean, I support that 100%, but you have to, it takes an outsider many times to say, I can see how sincere you are in your efforts to take care of your loved one, but I can see that it's taking a toll on you too. And we have to take care of you, because if we don't do that, you can't take care of the person that you love. And some people receive that very easily and others don't. And it's a bit of a back and forth and a dance that we just, between ourselves as social workers and with Gail Houseman, our mental health nurse, because we tend to see people together at clinic and do home visits together. We just really try to offer all the resources that could be there for them to help them be a better caregiver, a healthier caregiver, so they're not getting so worn down as well. It's very hard. Caregiving is very hard.
Yeah, even Captain America needs the rest of the Avengers sometimes.
Yeah.
Yes. Melissa, you talked about working here for 15 years now, and Anne has as well, basically almost about the same amount of time. So you have probably interacted with thousands of people with ALS in your time here. We care for over 1,200 people each year with ALS. Your caseload as a social worker with us is very large. How do you maintain that personal connection still to this day to make sure that you're treating everyone as a human being and not just as a number on a spreadsheet?
Um, that's a great question, Tony. I feel like as a social worker, I mean, I'm not a numbers person, so you just saying that number threw me a little. Like, you're probably right, but I'm not a numbers person, which is why I'm a social worker. um, and I feel like everyone that I meet, that's the part that I really love about it is to get to know them and understand, their situation and how we can support them and where they're coming from and to really, be able to support them. So I really just look at everyone that I meet as someone new that I'm meeting and a family and how, especially when the emails come in or that's not like you're hearing someone's voice. You can read between that. Like a lot of times, they're struggling or, and I'll reply like, I can come out and do a home visit or call me if you need to vent. And a lot of times, we'll talk to family members and at the end of the conversation they're like, thank you so much. I really just need it. I feel so much better just talking to you. We're not miracle workers. We're not unfortunately changing the situation. Their loved one still is ALS and they're still progressing. But I think, being a listening ear, um, maybe helping with solutions for, logistical things, it really can go a long way in making a family or a family member feel supported.
Yeah, I feel like if I told either of you a first name for a lot of first names, I wouldn't have to give you any more information. You would just know if I said, "Oh, I talked to Stacy today," you would probably have a good sense of who that is and what that meant.
Mhm.
Or if I mentioned a whole host of other people, even people who have unfortunately passed away, you would probably know them by first name and like one other detail.
Mhm.
I'm very amazed at everything you can keep in your heads.
I think that's part of the culture of ALS United Mid-Atlantic, that we're really one big family.
Mhm.
And a lot of people we just get to know, and it's just the nicest people that we meet. And we always say we wish we were meeting you under different circumstances. Um, but yeah, I do. I've actually been here, Tony. I'm going on my 17th year, and I I still have, Anne earlier was saying how the disease is so different for everyone. Uh, Almost at least 10 people that I have that were my first patients when I started back in 2008. And they're still with us. And you get to know people, and even people that progress quickly a lot of times, what we're doing, it's such a privilege. It's such an intimate time in a family's life, and we're there to bear witness and support. And so I think it's natural that you get to know them. I mean, not everyone's that way, and that's okay too. And that's part of what we do as social workers, really respect where people are and how they want to utilize us and all of that. So but yeah, I think it's definitely the culture that it's just a feel. And I feel that even like I love our team, our care services team, our Philly team, and then even when I go in the office, it's like so fun to see everyone. I just think we, as an organization, um, embrace everyone that way.
Yeah, I know that both of you have come to Phillies events, Lou Gehrig Day, and other things, and we'll walk around and see a number of families who we know, whether they're patients or they're volunteers or something, and they recognize you as fast as you recognize them, and it must be a really great experience to you to go to a Phillies game, which is a huge thing, and people are there they're happy to see you as much as they're happy to see the game.
Yeah, I think Melissa really nailed it. It really does have a sense of family. And obviously, I'm not related to my patients and so forth, and they're not related to me, but I don't, for you create this bond of, having ALS and being with those who are helping you navigate this disease, helping you manage it, helping to keep you as safe and as comfortable as possible. And it just creates this relationship that is just like heartwarming. I don't know how to say it. It's just you see them at the Phillies game and you want to go and give them a big hug because I'm truly happy to see them at a game, enjoying themselves with their families. I mean, it really, despite how sad and such a struggle this disease is, ALS, Mid-Atlantic does so many wonderful things to bring joy to our families and patients as well. And it's wonderful to be a part of that.
Yeah.
So,
And I would feel neglectful if I didn't ask about your work advocating in terms of insurance as well, because that's something you have done. I've talked to you about. I'm sure I know, Melissa, you do this as well, but I've talked with you specifically, Anne, about how you answer some questions and advocate for people to navigate insurance. It's always changing year by year, policy by policy, in Medicare and Medicaid. How do you keep up with all that, first of all?
our coworkers, I think each of us educating each other about the latest things that are coming along. Medicare puts out, quarterly newsletters and stuff about what's happening. And then just, talking with patients, families about their insurance plans and what's happening. I mean, just helping them navigate that educates you on like certain things that are going on within the insurance world. And every insurance plan is different.
Mm-hmm.
Not one is offering, it's not a cookie cutter type of situation like, oh, this is what everybody's getting across the board. It's not like that at all. So you really have to, learn about it, be as knowledgeable as you can be, and also really encourage and empower your families to seek out their insurers, find out what their benefits are, find out what they're entitled to. And if they're struggling with that, we, help them do that together. Let's see how we can navigate this together to get the answers that you're going to need. And then helping those who, are transitioning from working full time, stopping work, applying for Social Security, disability, and Medicare, and just kind of guiding them through that whole process is, can be overwhelming as well. So we're here to help them with that. So it's always changing, and, just be prepared for the, unexpected is kind of how the insurance world is.
And you can't tell people, here's the insurance I recommend, or take this policy over that, but you can kind of give them the tools, like you're saying, to here's the questions to ask, or things to consider for the next year or two, so that you're planning ahead with, I guess, not just with insurance, but through clinic in general.
Yeah. I mean, there's certain, I'm not an expert on the different plans that are out there, but there are certain things that we have all learned along the way that, with this disease, as symptoms progress, eventually needing a power wheelchair and more advanced type of care, certain insurance plans provide better coverage than other insurance plans. So we do try to educate them on, what would be better coverage, what's not so great. But at the end of the day, it really comes down to what their personal preference is as well, and what they feel that they can afford. And you just kind of, support them in whatever decision that they make. Fortunately, with our organization, we do have our loaner closet program with all kinds of pieces of equipment. So if there isn't great coverage for something that they might need, we most likely can provide it through the loaner program. So they're still getting the items that they need to help support their care.
Great. And Melissa, we have our Help and Hope event coming up. Excuse me, our Help and Hope event coming up on April 10th in King of Prussia, Pennsylvania. And you guys are going to be presenting about the work of social workers with ALS United. What should people expect from your presentation at Help and Hope? And I'm sure you hope to see some people there.
We certainly do. We're excited to be presenting. Anne and I have presented numerous times in the past, so we're excited to bring that show back on the road. It's been a while. But really, our presentation is about social work, our role as a social worker within the ALS community, and the impact that we have. We'll be really educating everyone about the different services and programs that we offer through ALS United Mid-Atlantic. I think it's always good to have a refresher and really just to understand encourage people to reach out and utilize their social worker. I think Ann mentioned earlier, we're always saying, if you have a question, reach out. When people come to clinic, it's information overload. So there's a whole interdisciplinary team there for 3 or 4 hours, so much information. And we often tell people, like, especially Jefferson clinics on a Friday, you're going to go home this weekend and be thinking about all this stuff. Reach out to us, send us an email, call us, like, we can go over everything again. We always say, like, this isn't a quiz or like homework. You don't have to memorize everything. These can be ongoing conversations, which often happens. When we talk about it initially, maybe you're not at that step or need it yet, and then when you need it, we're able to educate you more about it.
I think it'll be a great presentation, very useful for people. So I'm looking forward to the video that will come out from that, which will show more about your work and seeing the feedback and the questions people get. Because people are always able to ask you questions anytime. And again, for both of you, if they want to connect with you, they should just go on our website, right? alsmidatlantic.org.
Yes. Our contact information is there, our direct line, and our emails as well.
Yes. Under care services.
Yes.
And so you can go to our website, alsmidatlantic.org. You can go and meet the care team, where you'll see profiles and information and photos of every member of our care team. I think that's a really nice feature that we've added recently. So when you connect with us, you're not going to talk with some just AI chatbot. You're not going to just get some email response like a form letter. If you go to our website, you're going to meet Melissa Coll or Ann Cooney or someone else from our organization.
Yes.
Right.
100%.
And you're assigned a social worker, so we become your person. I mean, part of the bigger team and everything, but we're your person, your go-to.
And you're in their corner from the start.
Yes.
Yes.
Well, thank you so much for joining and talking about social work today. I'm looking forward to your presentation, and I really appreciate getting all the stories. And we'll be advocating together in Washington, D.C. as well to advocate for research and other issues to support the ALS cause. So, excuse me, Ann and Melissa really are in your corner. They're here to work for you, and we're all working together. Thank you so much for talking today.
Thank you, Tony.